Our exclusive interview with Dr. Wendell Boutte, some know her as the dancing doctor. The breaking news, though, the Georgia State Composite Board has suspended her license. I want to read part of this four-page ruling saying her practice of medicine poses a threat to the public health, safety, and welfare. So that's what we're talking about here. 7 cases are mentioned, a recent case just from a week ago. So we reached out to, for Dr. Boutte for a comment. No comment as of yet. We'll keep trying on that front. In the meantime, she was talking about other issues. We're going to talk here coming up about 5 medical malpractice lawsuits that she had faced. And in the midst of all this, I asked her, have you taken that second look? Have you done anything wrong? Here again, Dr. Wendell Boutte in her own words. As this has been a rough period, let's say, with some allegations coming your way and complaints, as I've mentioned, have you done the soul searching and thought to yourself, did I do something wrong? And what have you come up with?
Yes, I've done the soul searching. And no, I've done nothing wrong. As I said, first 18 years of solo practice and doing surgery, no problems, no legal events. But all it takes sometimes in life is one unfortunate, unpredictable, unpreventable event, and that can turn the tides. And I understand that deeply. I reflect on that daily. But what I know from being the daughter of 2 illiterate children of sharecroppers born in the 1920s and raised through the Great Depression, no matter how bad, how desperate the situation, you forge on, you plow on, you push through. And that is the matrix from where I came, and that is the philosophy that I teach my children, and here I go.
Yeah. And you are confident that you never look back and go, you know what, I got a little carried away with the singing and dancing, and maybe I wasn't as focused as I needed to be on the procedure.
Well, the procedures, 99% were done. They were already done.
But even in that 1%, you're
even
confident.
in that 1%, no, because it's 30 to 60 seconds. So the patient and I picked the time within the procedure that it was going to happen. And, you know, if it could be apropos to the song they chose or the song they wanted me to choose, then that's what, 30 to 60 seconds in the realm of what takes 3 to 4 hours of a surgery, 30 to 60 seconds. Think of that. And you know, you have other people monitoring. They're on a continuous monitor, monitoring CO2, oxygen, heart rate, blood pressure, you know, oxygen saturation, all of that good stuff. That's taken care of. I got that. So 30, 60 seconds, I'm a surgeon. I'm supposed to be able to multitask. I have to lead a crew of 8 people up there while I do your surgery, while I'm still checking the anesthesiologist on the monitor, because, you know, he'll often check me and say, you know, Dr. Boutte, you need to stay in your lane. Because I'm looking at the whole global, because that body on the table is my #1 concern. So if it takes me 30 seconds to pre-design, pre-stage, pre-plan, I know exactly when to do it, hit it, done. Let's go.
In our research, there have been, is it 5 medical malpractice lawsuits, 4 settlements at this. Why settle? I mean, because you sit here confident, so then the obvious follow is, so then why settle? Why not fight?
Mm-hmm. Again, when you go back to that point in time, 2.5 years ago, if you have, as I said, the entity using questionable means of acquiring cases, it's not far-fetched for within 3 to 4 months of that unforeseen incident for these cases to have blossomed out of the blue. So we as doctors, we by law have to have malpractice insurance, because we know in the realm of practicing medicine and surgery, things can go wrong. Sometimes your malpractice insurance will say, you know what, doc, it depends on the case, but you need to concentrate on doing the work that you do. You don't need to be bombarded with a case or a trial, or, you know, so settle and move on. So you know, so as you have to take the advice of the lawyers that the malpractice insurance hires, you know, and sometimes the malpractice insurance gives you an option to say, I don't want to settle. Or sometimes the policy is written where you don't have a choice of whether you want to settle or not. So you got to take all of that in perspective. When a patient comes to me and we perform the consultation together, me, the patient, we're a team. The point of it is I'm the technician, but the patient, you're called the shots. I can recommend what's best, but you at the end of the day call the shots. So if I, in general, say to you, you know, this procedure would be better for you than that, but in general, a patient has to consider a lot of things. They have to consider downtime. They have to consider their finances. They have to consider if what I'm proposing is going to leave a scar or this or that or the other. All of that, you know, is going through their mind, and I'm with them with that. And sometimes they're not thinking about that, but I am. I'm like, okay, well, if you do this procedure, do you have the care at home and the downtime, the off time? You know, so in general, you have to understand that sometimes you want patients that are realistic. You try to, as a surgeon, you're trying to get in their head and understand, are you realistic about what you're asking me to do? Every body that comes before me is not, each procedure they may come in requesting is not necessarily appropriate, or not necessarily appropriate, but it's not the best. But depending on finances, for instance, they're going to choose maybe something that's less. But I'm going to tell you, okay, if you choose to do that due to financial constraints or otherwise, let me show you a photo gallery. And we have a photo gallery, and we show the patients, this is, if you go with this procedure, which I think is going to be subpar as far as an aesthetic result, this is what, these are the possibilities. These are the options. Take a look at these outcomes and be clear that that could be you. Mm-hmm. Now, some patients say, well, if I look good in my clothes, Dr. Boutte, that's all that matters. That's all that matters. And I always say, well, you have to consider you're a woman, you know, intimacy. Are you going to feel good? If you see that picture right there, if that's you in an intimate setting without clothing, are you going to feel good about that? And sometimes in the moment, patients just want what they want. They're not considering what I'm telling you. You know, you're not. And I don't have a crystal ball, so I don't necessarily know this. I'm just trying to make sure they're well informed and educated about the options. And so let's just say in general, we as cosmetic and plastic surgeons deal with patients that are maybe not quite as realistic as we'd like them to be. And you have to consider your age, too, when you do these procedures. You cannot, I have patients that will bring me a picture of a 20-year-old, tight booty, banging abs, size 4. And if you're a size 16 or you're older and your skin is transparent with loss of collagen and loss of elasticity and without a tuck or without a breast dog, I can't make you look like that wish pig that you're bringing. Let's be clear here. I can only work with your matrix, with your foundation, what you bring to me, and I'm going to do the best humanly possible to make the best of that. And that's my promise to each and every patient.
Does it get antagonistic when they come back and go, I'm not happy? And do you say, I told you, or how do you handle that? Because that's what, in the numerous complaints that are coming your way as we sit here now, that's one of them, it's not happy.
Let me just say this. When my assistants go in, they take the photos, the measurements, they match up the before and afters for me. They write down their subjective part of, you know, the conversation with the patient. They come out and say, Dr. Boutte, we're ready for you to see the patient. And I read what the assistant wrote as to how the patient feels. Fortunately, most of the time, 90% plus, they're like, I'm happy with my results. And my little heart giggles. But if it says that there was a little irregular something in the right upper quadrant or left lower quadrant that the patient would like addressed. So I look at, did they sign the forms where they declined the procedure I thought was the A procedure, the best procedure. And in that, on that declination form, it says, if you don't choose this, then understand you can get irregular texture, you can get something called seromas, which are fluid pockets, you can get chronic inflammation called cellulitis that takes a long time to heal. The skin will get firm and rubbery and stay that way. You have to get lymphatic massages more frequently. All of that is in writing. So I pull out that form before I go in, and I'm ready with that form. Because I'm going to tell Ms. Smith when we're looking at before and after, remember the conversation we had when I said if you choose option B, here's what you initialed understanding could happen. And here's what you signed and dated at the bottom of it. There is no argument. The patient's 99% of the time, you're right. So now, Dr. Boutte, what can I do next?
You've mentioned a few times, I think it was negative entities or negative agendas. Who's coming after you and why?
I think you know the answer to that question.
Money?
I think you know the answer to that question.
Interesting way to wrap things up there. We had mentioned the breaking news, by the way, that Dr. Boutte has had her license suspended, her medical license suspended in the state of Georgia. We reached out to her. No comment as of yet, but she has 2 weeks to request an expedited hearing.